all of us know that heart failure is number of patients for heart failure is increasing exponentially. We have a very almost 10 million patients in India who is suffering from heart failure. That is approximately 1% of our population. And in spite of that, the awareness is not much what it should be. Now, all of us know that whenever a person is diagnosed with cancer, all of us know that, including the attendants and patient, they are very much concerned, and they just want to get the best of the treatment, because we all know that cancer is a very dreaded disease and it has got a very high mortality. But you will be surprised to know that heart failure actually has a much bad mortality compared to many of the cancers. Like I'll tell you that like your breast cancer has a survival mortality rate of 11% at 5 years, and Hodgkin's lymphoma has a mortality of around 15% at 5 years. But if you will be surprised to see that heart failure will have a mortality of almost 50% at 5 years. So that shows that heart failure is a very progressive disease, has got a very high mortality rate compared to many of the cancers that we know regularly. So that shows that heart failure should be treated aggressively, should be managed very aggressively, and we should not delay or hesitate to use the guideline directed medical therapy in heart failure patients, because by hesitating or by delaying the treatment of heart failure, we are actually denying years to the patient's life. So that shows that heart failure actually needs to be treated, because it's a very progressive disease, it has got a very high mortality, and you will be surprised to know that if with every successive heart failure hospitalization, the mortality rate increases and patient survival rate decreases. So number of years patient is going to survive will be decreased with each successive heart failure hospitalization. So that shows that it needs a very careful monitoring as well as careful treatment, which should be tailored according to the patient's clinical situation. So every patient is not same, every heart failure patient has not the same, because every patient will have different clinical situations, every patient will have different etiologies for heart failure, every patient will have different comorbidities. So accordingly we have to choose our molecule, and we have to very carefully treat these patients. Otherwise, mean survival of these patients with each successive heart failure hospitalization is even less than 2 years.